Hi, I'm Jack Andraka for The Scoop. We're here with Felix Jackson, who is the director of medDigital, and previously you were an anesthesiologist. So how do you go from anesthesiologist to medical communications?
Well, like everything, I didn't plan it. It wasn't exactly a career option that I moved into, but I ended up working with DoctorsNet UK, which is the largest community of doctors in the UK, and from there just kind of moved on out towards kind of digital technology. And then one day I thought, well, I'll do my own thing, I'll set up my own company, and 5 years on, here I am.
Awesome. And how important is communication in a good healthcare system?
I think it's vital. I mean, communication day to day is so important, handing patients over, talking to other doctors about stuff, and doing it digitally, I think, brings it onto a much more international and global level, and that's really important because so much of patient care can be done by so many physicians around the world.
Awesome. And now, how is your new company, medDigital, helping to revolutionize healthcare through digital communication?
Well, it's a great question. What we're trying to do is build some specific tools that really help specific problems. We work a lot with companies who want to do this, some of them pharmaceutical companies, but more broadly beyond that as well, where we're trying to get into healthcare and really solve problems that exist with digital communications. For example, we've got a tool coming out this year, which we're going to launch towards December. And what we want to do is really help doctor-to-doctor communication. Which is a problem. Lots of doctors really struggle in a busy working day to chat about patients, to share patients and talk about cases, and we're going to try and help them do that online.
Now, what is the most fascinating thing that is happening in digital communication healthcare right now?
Well, for me at the moment, it's medX. I mean, I love. There's lots of great healthcare conferences where lots of people come together and chat about stuff. But MedX has been really interesting for me because it's such a different perspective. For me, coming over to the US to see how people are doing it over here and how they're thinking about it, it's really different and it's really unique, and it's lovely to experience that in MedX.
Yeah, and how does it differ between the US and Europe, for example?
Well, that's a great question. I think one of the things that's really struck me here is the inclusion of patients. We saw Nick Dawson this morning talking about participatory medicine, which is one example of that. But the way that people are really working with patients to solve the problems, I think, is fantastic. I think also there's a much more entrepreneurial approach. It's natural for everybody to have their own ideas and their own companies and be doing that. Whereas in Europe, often that's seen as a bad thing. You're either a kind of doctor or you're an entrepreneur. Whereas here, people are both.
Awesome. Well, thank you so much. For The Scoop, I'm Jack Andraka.